So anyways, a negligible increase in other cancers in the future. I go, really negligible, huh? Why are you telling me about it then? What's going on here? I don't have the figures, okay, right now. But basically, and first of all, why? Why is there an increase in cancer? I thought that this only hurt, that I was told before I agreed to surgery, that the radioactive iodine treatment only targeted, it's like a heat-seeking missile, only targeted thyroid cells, that thyroid cells were the only cells in the body that used iodine. Why would any other cells be hurt? So, if there's an increase in other cancers, that means that it's affecting other cells. Okay, it means that what you're giving me to kill cancer causes cancer. That's what that fucking means. That's what that means. Why would there be an increase in other cancers? We've identified it is because of the radioactive iodine. Why would there be an increase in other cancers if that doesn't cause cancer? The answer is because it does. Oh, okay. By the way, at this point, I've spoken with many older people who have had cancer, who have gotten radiation done, and it's, there are different types of radiation, but I've spoken with multiple older people who've had radiation done to treat cancer, and as a result of, admitted by the hospital, as a result of that radiation, they got a different form of cancer in another tissue in their body. So, with radioactive iodine, it's supposed to be, I think, slightly safer, but I don't know, honestly. I'd have to look at the data. I think that's kind of what I was led to believe, but obviously, as you might be getting with the story, I was led to believe a number of falsehoods. So, anyways, the other fun thing about this is that they use this radioactive iodine to treat thyroid cancer, and most people who get thyroid cancer, there are more and more people getting thyroid cancer at young ages like me, but they've been using this historically mostly for older people, so they usually die of fucking something else before they die of the cancer that they begin with radioactive iodine. But with someone like me, who was 26 when I got my thyroidectomy, the radioactive iodine has an increased chance of giving you cancer than someone getting radioactive iodine when they're 75 or 50 or 45. Every single year that your heart continues to beat after you do the radiation, there's a higher chance that you will get another form of cancer as a result of accepting the radioactive iodine treatment. So what does that say? It's like, no one's saying this in the hospital. It's like zipped lips, bro. But it's like, what does that imply? It implies that the damage continues for the rest of your life. That's what it implies. It's not something that you heal from. You're given radioactive iodine, and then the longer you live, the more damage the radioactive iodine is doing to your body. The higher chance you will develop another form of cancer. I don't know, change my mind. You know what I mean? So, okay. Third surgery. Oh my god, you still have cancer. Your blood says that you have cancer still. Number 1, huh? Okay, wait, you can tell from my blood if I have cancer still? Okay, that's good to know. That's important to know. Wait, doesn't that mean that we could have checked my blood before doing the chest surgery? We don't know where the cancer is. We're going to do some scans, but if we can't find it, we're going to give you this other thing called radioactive iodine 123. Significantly less radioactive. It's still not great for your body, but it's not killing cells. It doesn't kill cells like the the other one, which is 131. We're going to do 123, and we're going to locate the cells, the thyroid cells in your body, so we'll know where the thyroid cancer is. Because thyroid cancer can go, technically, like a lot of cancers, can go anywhere in your body. If there's still a thyroid cell, we can locate it with the radioactive iodine 123. So I'm discovering this a few months after my chest surgery. At this point, I've had a brutal dry cough that begins the moment I sit up in my bed in the morning and ends when my body finally calms down enough when I'm lying in bed to go to sleep. And it's literally all day long. I'm coughing like, I don't know, 20 times, 5 to 20 times a minute. I've lost like 15 pounds. And I'm told that there is a test, radioactive iodine 123, that can locate cancer in my body, identify it, without surgery, without biopsies. So, I discover months afterwards that I consented to a surgery under multiple false premises. One, that the only nerve damage I would get would be topical. And two, that the only way to identify whether or not the masses, aka lymph nodes, aka healthy components of a working immune system that's probably fighting cancer off in my chest, I was told that the only way to know whether or not they were cancer was to remove them with a fucking knife. When I'm told now, months later, oh, we just give you this pill and we put you in the tank and we know exactly where any leftover cancer is. Turns out, my first surgery, they left tumors in my neck, big ones, 2 of the biggest ones. I had to get a 3rd surgery. Okay. That fucking sucks, but doesn't seem like there's any malintent necessarily. Doesn't seem like it. No evidence, you know. And my first surgery was 5 hours, and it was pretty extensive. It was ironic because the very tumor that they biopsied to confirm that I had cancer was left behind. So, part of it had been cut away, but yeah, it was left behind. So, little strange. Anyways, ow, fuck. So, where are we here? Oh yeah, the best part. So, my chest thing adjusts. 2 months, the cough stops. My breathing is still impaired to this day, 2 years later. There's sort of like a ratcheted style of breathing now. You know, I don't breathe as efficiently. There are issues, you know. It's a vagus nerve. It does a... Fuck, man. Everything in nature has like 4 jobs, 5 jobs, 15 jobs. The vagus nerve, you know, it's not like the entire thing was severed, but part of it was a branch of it, tendril, and it does a lot more than just open and close a windpipe. So, who knows what else neurologically was affected, homeostasically, you know. So, a few months, you know, after my surgeries, I don't feel like myself. I got anxiety, heart palpitations, having trouble thinking. I'm on a daily pill, 125. They have to suppress any thyroid growth, which means that they're intentionally giving me more of this hormone than my body's actually asking for, which makes things haywire-y. And they go, we gotta do this for 6 years. We gotta keep you on this for 6 years to keep the cancer from coming back. I'm like, 1950, huh? That's when you guys figured this out? Really? You haven't, like, gone back to the drawing boards at all? Didn't feel like it? Billions and billions and hundreds and billions of dollars in cancer research. We just didn't. We're not gonna go back to the drawing board on this one. You kind of figured it out in 1950. We're good. Right. Oh, that's cool. No, no. Oh, yeah, no, I should be grateful. Right. I should be grateful to the species that polluted the environment so that I got cancer in my early 20s. I should be grateful. So, a year goes by. It's now fall 2024, late summer. My heart is tired of heart palpitations. Suddenly, I have a heart palpitation like attack. No matter what I do for 5 days, my heart won't stop beating super hard. Like panic attack hard for 5 fucking days. I wanted to kill myself. I was like, yeah, I want to die. Everything gave me anxiety, like calling. I was like trying to call a car shop up or something, and I was like terrified. I was like, I was trying to move to another state halfway across the country at the time. I was like, I can't fucking do this. I was like, okay, fuck this super high hormone dose. Let me reduce it for a minute, try and stop the heart attack fucking symptoms. So I reduced my dose. I stopped taking my pill for a few days, my hormone pill. Reduce it to something like 50% for about a week. Feel significantly better. And then on day 10 of this protocol, I have a severe, essentially attack of brain fog and hypothyroid symptoms. I had been having vision issues too with the heart palpitations, and leading up to the heart palpitations, I've been having vision issues, which the thyroid hormone is related to like every system in the body, practically. So, and the eyes are affected. It's just like it's unending. There's a reason why nature gives you a gland and not a pill, for this and for many other things. But we do what we can, right? But like, you have to think about these things. Humans, why is there a gland? What can we do to match it? If we're going to take it out, is one pill really enough? And we're going to learn that it's not even fucking close. So start having extreme brain fog. Like, I feel like I'm drunk, high on like paint, like paint fumes. Serious memory issues, serious language issues, serious focus issues. Literally dizzy. Fucking mess. I'm like, I really fucked myself up. Holy shit, I should not have stopped taking my pill, except I wanted to kill myself because my heart palpitations were so bad. Let's go to the doctor. Doctor says, go back on your meds. You should be good in 6 weeks. Okay. I was already back on my meds for like 3 weeks at that time when I saw the doctor, I think, something like that. So I stayed on my meds for another 2 weeks, and then I got ready to move. I was moving halfway across the country. Traveled. Brain fog was really bad in week 6. Like, some of the worst I'd have. I was like, this is not a good sign. Long story short, hypothyroid symptoms continued. Skin numbness, brain fog, fatigue, achiness, like just malaise, continued for something like 14 weeks. And then they started to get better, February of 2025. I was like, thank fucking God. They were so bad, to just give you an idea. They were so bad, there was no, I would be fine for about 2 hours in the morning, and then it would hit me. I'd have to go lie down for 6 hours. At times I really didn't feel like safe driving. like really not safe driving. We're talking about serious cognitive impairment. So it starts to get better in February. I'm like, sweet. Started to get ready to kind of like put my life back together. Right around March 1st, Symptoms return. Don't know why. Symptoms return. Added with heart palpitations now. So I've got brain fog and heart palpitations, which are supposed to be two ends of the spectrum. Hyper and hypothyroid. Too much and too little. The hormone. Have them both at the same time. It's pretty much hell. Start to figure out, okay, these people don't know what the fuck they're talking about. Gotta figure this shit out on my own. Get super into ChatGPT. Fucking AI. Figure it out. Pretty much. Starting from day one, they should have prescribed me 2 hormones, minimum. Something called T4, which they already given me, and T3. T3 is the active hormone that the thyroid produces and converts from T4 to T3. The rest of your tissues, organs, they convert T4 into T3. T3 is what's actually used by human cells to, like, run. So, yeah, I mean, without the thyroid, you're missing like 30% of the T3 that you need. And your body also converts T4 into this blocking hormone called reverse T3. So if you flood your body with T4 without any T3, you will overproduce this blocking hormone and obviously underproduce the T3 because you're not getting like 30% of it. So in effect, you could be somewhere around like, you're at least 30% low in this T3. Even more with the reverse T3. So I figured this out with ChatGPT. Personal research with ChatGPT and the internet. Wasn't told any of this by any medical professionals. When I first introduced the idea of taking T3, the doctor who's in charge of my hormones, endocrinologist, the endocrine system doctor, I suggested, hey, I think maybe I need T3. He goes, oh, that's for like fine tuning. You have something else going on, clearly. After I learned about the reverse T3, it was very clear to me, okay, I should at least try taking the T3 hormone and lowering my T4. Did that. 2 weeks I started to feel better. 6 weeks I started to feel pretty much exactly like myself again. Well, I'm not going to say that because I'm not exactly like myself. I'm like 80% better. So it took 2 years to be prescribed, after the thyroidectomy, to be prescribed the correct hormones. As a cancer patient, I had to figure out on my own what my hormone prescription should be and what the doses should be. Personally, I mean, thank you OpenAI for helping me so much. It would have taken a lot longer without ChatGPT. I personally figured that shit out 2 fucking years after my surgery. Again, oh, don't worry, I know it's scary to have cancer, they said, but we developed the treatment in the 1950s. And you're going to be perfectly fine. Vagus nerve. Damaged. No justice, by the way. Lawyers don't want to take the case. Not enough damages. There's not enough. I have to be like fucking on a breathing tube for them to be like, okay, well, it's worth pursuing this case. I'm still working on that, though, but I think there might be a way to do it, but it's very difficult. 2 years of not being on the right prescription. 3rd most common extractive surgery in the nation. 2 years of being on the wrong prescription. Having to have a 3rd surgery sucked, but you know, it's not as bad as the other issues. So anyways, I I still need to change my prescription because they only give you the shit that dumps the hormones in your blood like immediately. And it's causing me heart palpitations and stuff. And I need to get a different prescription that releases the hormone more similarly to how the thyroid does it slowly throughout the day. And it's not FDA approved in 2025. It's not FDA approved in 2020 fucking 5. Oh, we developed it 75 years ago. We developed the therapy for treating thyroid cancer 75 years ago. And since then, have you guys been playing like solitaire or something? Where's the money going? Guys, hello? We are taxed. We have donated hundreds of billions of dollars to cancer research. You got tons of people working on this shit for like not that much money at universities across the country who paid tens of thousands of dollars in tuition. Where are the results, people? So I have to find a doctor who's not in a hospital system because they are prohibited from prescribing the slow release hormone if you work in a hospital system. Because you have to get it at a compounded pharmacy and it's not FDA approved. There are like state approval boards for these pills. So if I want to be able to think, you following me? If I want to be able to think and not have heart palpitations, which, if I don't do something about my heart palpitations, statistics show I am probably going to die somewhere between 5 and 10 years earlier than my normal life expectancy of some sort of heart failure. Okay? This is the standard treatment for cancer. Not to mention the few decades till then where, let me just describe to you what a heart palpitation is. It means increased force of contraction, meaning the force that your heart is using to contract is more than is necessary. Anything that's more than necessary in nature usually causes problems, okay? It means increased anxiety. It means that I'm more sensitive to adrenaline. I was experiencing this both on their original protocol, and I'm experiencing it now on my protocol. The only thing is now I can think on my protocol, because before my brain didn't work. Because nerve cells are so plastic, they're very vulnerable to things like low hormones, stuff like that. So my brain works now, but I'm dealing with heart palpitations and increased sensitivity to adrenaline, meaning that if you get a little, if something would make you a tiny bit nervous, it would make me very nervous. Not because I want to be, but because you don't give alcohol to a 10-year-old. You know what I mean? Like, that's what I'm talking about here, you know? So in order to get the slow release hormone, I have to find a doctor who will prescribe it. And so far the only one that I've found who will does not take insurance for some reason. I don't think it's a good reason, you know? I think it's probably I don't think it's a them problem. I think it's an insurance problem. But I don't know. I don't know exactly. But the only one I found so far who can prescribe what I need does not take insurance, and I have to pay out of pocket, and it's not fucking cheap. The only option I have found so far. I have health insurance. I've been to an enormous amount of appointments at the hospital. Right now, I have to choose between being able to think and having a heart that's beating normally. Under the current state of healthcare in the United States of America, an insured person like me who has the good cancer that has the same treatment whose treatment was developed in the 1950s, I have to choose between being able to think and not having fucking brain damage. I have to choose between brain damage or heart damage right now. So amazingly, in a way, I'm still alive. But yeah, I wasn't able to work for like 7 months because I was fucking catatonic 50% of the time. And now my only option for regulating my body's physiology requires me to pay extra money out of pocket to an alternative doctor that insurances won't work with. And I know I'm not fucking crazy because I had brain fog for, it was like 8 months, October to, I started getting better in May. And it's 2 months now, and I'm like I said, I'm 80% better. I still have brain fog on the fringes. Like, actually, I need to go take my afternoon hormone right now. But in general, I feel pretty good. But I'm hyper anxious. My heart is beating way too hard. And the only reason I'm better than I was is because I did my own research into what the thyroid is, how it works, what it needs, what it does, what I need if I don't have a thyroid, and I figured it out on my own. And just to top it off, the healthcare system is severely understaffed in the United States. And if you recall, a couple of years ago, an enormous amount of healthcare workers were fired by hospitals for a reason. And now there's a bunch of people with cancer who need help from a healthcare system that laid off an enormous amount of people a couple of years ago. So yeah. If you can avoid it, don't have any important parts of your body removed. If you can delay. If you can, look into it. Do not trust the word of a doctor at a hospital. Do not trust the word of a nurse, support staff. Do not trust them. It's always good to assume, if you have to assume anything, incompetence over malintent, malevolence. Okay? But it's better not to assume. Good luck, everybody.